The aorta is the main blood vessel that takes blood from the heart to the whole body. And aortic aneurysm is basically a blood vessel that's bigger than it ought to be. A lot of what we can do for patients depends on the location of the aneurysm. And any aneurysms here in the front in the ascending aorta, for the most part, are treated with surgery. So once you get to a certain dimension at that size, then we would recommend an operation.
Most aneurysms are asymptomatic, and they're found incidentally by chance when imaging is done for another purpose. So if someone has a CAT scan or an MRI for a different reason, then the aorta is part of that scan, and if it's enlarged, they will notice that. In an open surgery for repair of the aorta, we resect out the part of the aorta that's enlarged. We replace it with a synthetic fabric, and we take out the bad piece and put in the new piece.
Now, for those patients who have leaky valves, particularly the young patients who have these genetic-based aneurysms, we do a procedure called a valve sparing operation where we can remove the aneurysm in its entirety. I'd say 90+% of the time we can save your valve when you have a leaky valve. The average aneurysm operation for here is done through an incision in the middle that's about that big. The operation in general is about 4 hours, and then from there they go directly to an intensive care unit.
I recommend to patients to come be treated here or followed by us because of our experience with aortic disease. And this is one field that we feel that we give the best treatment that exists in the world. And by coming here, you'll be treated by the most experienced people that this is what they do every day in their life.
Across the United States, the average risk for an aneurysm of the ascending aorta is between 2.5% and 4.5%. Our risk for the last 2,000 plus is under 0.6%. So we think that expertise and experience counts for a lot. And so in a center like this, where we do hundreds and hundreds of these every year, practice does make perfect. A heavy contributor to a risk of less than 1% is the anesthesiology team and the critical care teams and the nurses and the other staff in the hospital being familiar with the aneurysm patient.
It's very important to monitor the aneurysm once it's discovered. Our aneurysm program is really a world-class aneurysm monitoring program. So even when we have patients that travel from far away, even if they get their scans locally, we're able to get these images and get them into our system so that if we need to see them and measure them ourselves, we're able to do that.
We encourage you to call us up, make an appointment, come in and talk to us. I think we're pretty good at explaining what you have and what you need. We can make you better. We can make you live longer. We can make your heart work better, and we can make you feel better down the line. So please come in and talk to us.